wonderful event. So just wanted to say a couple of quick words really quickly as we get prepared for Vicki to jump on and educate us about Medicare. So just very quickly about Oak Street Health. We're excited to be one of the sponsors for this event this next couple days here. And just wanted to tell you all that we are a group of primary care doctors' offices specifically designed to serve Medicare patients only. So this is actually a very relevant presentation to the patients that we serve. We have locations all over Illinois, as well as a few other states. And so just a little bit more that we will be offering on September 15th at 11 a.m. Oak Street Health, we will be welcoming some of our medical directors to do a COVID town hall presentation coming up next month. So again, that's on September 15th at 11 a.m. If you'd like to join, it'll be a virtual event similar to this, where you can learn a little bit more about Oak Street Health and ask some more questions of our providers and our medical leadership. So please feel free to join us for that as well. We'll be jumping on and off throughout this event over the next couple days. So without further ado, I'd love to introduce Vicki Madigan. Vicki is an insurance agent, broker, owner of Madigan Insurance Group Incorporated. Prior to opening her insurance agency in 2001, she spent most of her career in public education and corporate training. As an agent and broker, she draws heavily upon her vast background in teaching to help present complex insurance issues in a style that makes sense and are easy to understand. Educated consumers are in a much stronger position to help structure healthcare coverage that meets their specific needs. Techniques developed for successful teaching meld easily with the concept of a consultative enrollment process and produce positive outcomes for her clients. Along with her specific insurance-related education, Vicki has a bachelor's in corrections and alternative education from Western Illinois University and a master's in managerial leadership from National Louis University, Chicago. Her postgraduate credit in technology and education from Pittsburgh State University as well. She holds a valid teaching license in grades K through 12 in Illinois. So a very impressive background for Vicki. So we're super excited for her to present Medicare Made Clear.
Good morning. I hope I'm starting at the right time here. This is a new experience for all of us, but I'm glad to be with you at the virtual fair today. And we're going to be talking about Medicare. Here's some information about our insurance agency. We have now 6 licensed agents working with us out of our Huntley location, although they also do in-home visits or meet in public places if you're more comfortable instead of coming to the office. You can call the number 847-457-1802 and you can get more information. So today's agenda is, what is Medicare and who is eligible for Medicare? What are your coverage options? When can you enroll? What are your next steps? And where can I find more information? We're going to give you some very basic information about Medicare today, but enrolling in Medicare is really a personal decision where we sit with you to determine what is the best prescription drug plan for you based on your medications, and what is the best healthcare plan for you to be enrolled in based in your current situation. So to be eligible for Medicare, you need to be a United States citizen or a legal resident for at least 5 consecutive years. You need to be either 65 or older, or someone younger than 65 who's been on disability for 24 months, or at any stage with a diagnosis of end-stage renal disease, which is kidney disease, or ALS. Let's look and see what your coverage options are. We're going to talk today about Medicare Part A, Part B, Part C, Part D, and Medicare supplements. If any of you have this book that I'm just going to show you really quick here. Oh, maybe it didn't work. It's called Medicare and You. You get it from Social Security. This chart is on page 6 of your booklet. This shows you the 2 roads that you can take to obtain drug coverage and healthcare coverage as secondary coverage to Medicare. On the left of your screen, you'll see the Medicare ID card. The card has changed due to the macro law in 2020. It is no longer your social security number with an alphanumeric character. It is now a series of capital letters and numbers. And one of the reasons that we have the macro law and change the Medicare ID number was to protect your identity. Once you have the Medicare card, then you as a consumer can choose to go down the original Medicare lane and get a prescription drug coverage, which is a standalone plan, or you can purchase a Medicare supplement. If you choose to go in the right lane, which is called Medicare Advantage or Medicare Part C, those are plans like HMOs and PPOs. You can do that as well. What you cannot do is drive in both lanes at the same time. So it's an either or. I put some definitions in the PowerPoint since not everyone is insurance vocabulary savvy. So we're going to talk really quickly about what is a premium, what is a deductible, what is a copay, and what is a coinsurance. So the premium is the amount of money that you pay to have your plan. The deductible is the amount you as a consumer must pay before the plan or Medicare starts paying for cost. A copay will always be a dollar amount, like $10, and a coinsurance will always be a percentage. Let's talk about your Part B premium. On your red, white, and blue original Medicare card, you have a hospital Part A. The Part B premium is either deducted from your Social Security prior to the direct deposit, or if you are not receiving Social Security income, you will then have to mail your payment to Social Security. So just to clarify, if you're listening to this presentation and you're turning 65 in the near future, your Medicare starts at your Social Security office, where you apply for Medicare Part A and B. And I recommend to my clients that they give that a 4 to 6 week process. You can apply there, or if you want to go on the website, it's www.ssa.gov. For 2020, the Part B premium was $144.60. That will change in 2021, but we do not have the numbers for that. IRMA is a penalty that could be applied to either your Part B or your Medicare Part D premium due to an increased amount of income determined by the IRS and Social Security for 2 years prior to the year you're in. Let's talk a little bit about the different parts of Medicare. I like to tell the clients that the word part before each of these alphabetical letters is important, because you're going to see when we talk about Medicare supplements that there's also alphabetical letters. The word before those is plan. So there's a difference between Part A and Plan A. Part A is on your red, white, and blue Medicare card, and it covers only 5 items: inpatient hospital care, inpatient mental health, skilled nursing services, hospice care, and some blood transfusions. If you can look at the graphic next to Part A, it shows a picture of a hospital bed with a big capital A. I like to help you remember what Part A stands for. It means admitted. You're admitted to a hospital, you're in a bed, you're pretty sick, and you can't go home. So that's what Part A covers. Now we're going to look at Part B. Part B means you're in outpatient status. You can leave, you can go home, or you're in observation, possibly after going to an emergency room. Please add and note that the emergency room, even though you're walking into a hospital, is covered under Medicare Part B. So Medicare Part B covers doctor and outpatient visits. And with Medicare, you have 23 preventative services. Let's talk about what does Medicare not cover under original Medicare. It does not cover your Medicare Part A and Part B deductibles, your coinsurance, or your premiums. It does not cover Medicare Part B excess charges, which could be an amount billed over what Medicare agrees to pay. It does not cover prescription drug coverage. And unfortunately, it gives you no benefits for hearing, vision, or dental. It does not cover long-term care or custodial care if that is the only care you need. Most nursing home care is custodial care. In 2020, we had deductibles and coinsurance to original Medicare. So of the original Medicare card, Part A, the deductible for 2020 is $1,420. This deductible can renew during the calendar year based on the Medicare benefit definition, which is a 60-day period. You are also, as a consumer, responsible for 20% of the coinsurance of Medicare approved cost. And it has no maximum out-of-pocket. Medicare Part B deductible for 2020 is $198 one time per calendar year. This deductible will change on a yearly basis. You have 20% coinsurance of Medicare approved costs. And again, Medicare Part A and B have no maximum out-of-pocket. I call that OOPS, out-of-pocket expense. Let's look at what is a Medicare benefit period. So a benefit period is the way original Medicare program measures your use of inpatient hospital stay and skilled nursing facility services. It begins the day that you enter a hospital or a skilled nursing facility, which we abbreviate SNF, and ends when you have not received inpatient hospital or Medicare covered skilled care in an SNF for 60 days in a row. So pretty much what that means to you is that that deductible could be charged to you again in a calendar year up to about 6.5 times, leaving you truly with a Part A Medicare deductible of close to $9,000. So as you can see by looking at the graphic for original Medicare Part A and B, they leave you with many oops, many out-of-pocket expenses in deductibles and in coinsurance. And one of the ways to minimize those costs to you as a consumer is to enroll in a secondary insurance called a standardized Medicare supplement. Medicare supplement insurance plans help cover some of what Medicare Part A and B do not. They are all offered by private insurance companies, and let me add that they are federally regulated. Here we have that word plan that I referenced earlier. We have plans A, B, C, D, F, G, K, L, M, N, and high deductible plan F. Benefits vary by plan, and generally the more comprehensive your coverage, the higher your premium. Now, if you're joining us from Massachusetts, Minnesota, or Wisconsin, you have totally different rules, but we can help you with that. Our agency is also licensed in the state of Wisconsin and many other states. This chart, which you will also find in that Medicare and You book that comes from Social Security, is located on page 70. It shows you the A to N Medicare supplement plans. Now let's spend a minute here and teach you how to read this chart. If you look where it says benefits, those are all of the benefits of original Medicare. And those are the charges that get passed to you, the consumer. So let's just do a quick example. Look at Medicare Plan A, and you'll see the Medicare Part A coinsurance is covered 100%. The Medicare Part B coinsurance or copayment is covered 100%. Your first 3 pints of blood are covered 100%. And hospice Part A coinsurance and copayment are covered 100%. But if you look at the remaining items in the list on the left, and under Plan A, you do not have a number, which means you would not have coverage for those benefits. Now, most of you are aware of the famous Plan F, because that has been the Cadillac plan for many years. And basically, that plan has no cost sharing to the consumer. So if you look at the column under the letter F, you'll see that everything is paid 100% as far as Medicare charges. In 2020, also the macro law that I referenced earlier did away with Plan F because it has no what we call cost sharing. Now, no panic. If you were on Medicare Part A and B, and you can look at that on your red, white, and blue card, in your dates for Medicare Part A or Medicare Part B were prior to 1/1/20, you are grandfathered into Medicare Supplement Plan F. So those of you turning 65 after January 1st, 2020 would not be eligible for Plan F due to the macro law. So I'd like you to look at letter G right next door to Plan F. and you will see that G and F are very comparable in cost. So everything is covered the same in a Plan G with one exception, and that is your Medicare Part B deductible, which is $198 a year. Many consumers made the choice prior to January 1, 2020, to leave Plan F and go to G for quite a bit of cost savings, not only in premium, but for future premiums. And if you join us at our office or in another one-on-one meeting, we can explain to you why that might be of benefit to you. What do you need to do to be eligible to purchase a Medicare supplement? First of all, you must be enrolled in Medicare Part A and B. That's that red, white, and blue card. You must be a resident of the state in which you are applying for coverage. So let's say you own 2 pieces of property. You have a home in Florida or Arizona, and you have a home here in Illinois. It's what your resident state is. We like to go by what your driver's license states. So if you live, for example, in Huntley, Illinois, and you have a home in Florida, and you're legally the resident of Florida, then I need to enroll you in a Florida plan, not an Illinois plan. You must be age 65 or older, or if you're under 65 with certain disabilities and qualifying health conditions. Last thing, any person with end-stage kidney disease is eligible for Medicare. Now we're going to go talk about Medicare Part D. That's the drug plan. What does that do? It helps with the cost of prescription drugs offered by private insurance companies. Some fast facts about Medicare Part D is that prescription drug coverage varies from plan to plan. Illinois has about 16 plans for 2020. It protects you from catastrophic coverage and high drug costs, and your benefit plans will change each year. I'm going to stop here and add something. Each of you that has a Medicare Part D plan will receive a booklet in the mail from your private insurance carrier for your Medicare Part D called the Annual Notice of Change booklet. It will be in your mailbox the last week of September. It's usually about an 8.5 by 11 booklet, sometimes packaged in a clear or white plastic bag. It is very important that you open that bag and look at that plan document, as it tells you how your drug plan is changing in 2021. To enroll in a Medicare Part D, each plan has a list of drugs that it covers. That's called a formulary. Make sure your drugs are covered before you enroll in a plan. The list of drugs can change each year, and if you're turning 65, coverage is not automatic, and if you enroll late, penalties may apply. So we talked a little bit about formulary. All medications have a tier, and the higher the number on the tier, the more expensive your medication is. So you will, when you're looking in that annual notice of change for your medications, or if you're new to Medicare choosing a drug plan, you want to have an analysis done of your medications. You want to find out if your medications are on the formulary and at what tier level those medications fall, which will give you a better idea of the type of expense you can incur each month in copays. Okay. We're going to look at this chart about how the Medicare Part D yearly coverage process goes. I'm sure many of you have heard of the famous donut hole. My employee, Jenna, created this document so we can have a little bit easier discussion about how the donut hole works. So each year, Medicare assigns a deductible for the Part D plans. We already have our 2021 numbers. The enrollee pays $445 in deductible in 2021. And remember, a deductible is something you pay prior to the plan paying. If your medications cost more than the $445 for the year, you then leave the deductible stage and move to what's called the initial coverage stage. Medicare will give you a sum of money each year to offset the total retail cost of your medications. Each plan has a formulary and the tiers which determine the consumer's copay. So when you spend through next year your $4,130 to help offset your medications, your bank is now empty and you fall into the coveted donut hole. Okay, so in the donut hole, or what we call in Medicare the coverage gap, you as a consumer will now pay 25% of the retail cost of your medications. So let me give you a quick example. Let's say we have a medication X that costs $1,000. You are now in the coverage gap, you will pay 25% of that, which is $250. Once you pay up to, I think it's $6,350 next year, then you move to the catastrophic coverage stage. Then you're paying 5% of that total cost of that drug. Now, many consumers never leave the deductible stage. Most people stay in the initial coverage stage. Some people move to the coverage gap, and fewer people move into catastrophic coverage. But the whole process restarts on January 1 of every year. This is the 2020 donut hole. This shows you all of the amounts of money for 2020. Our deductible this year was $435. There is a penalty if you enroll in Medicare Part D late, and that penalty stays with you for your lifetime. So the question I get quite a lot is, I don't take medications, why should I enroll in a drug plan? Because down the road, should you take medications and you enroll in a drug plan later in life, you will pay a high penalty that will stay with you. All right, we're going to quickly talk about Medicare Advantage plans. These are Part C plans. If you refer back to the chart that I was discussing earlier, this is the right lane of the chart for secondary coverage. Medicare Part C plans combine all of your coverage of original Medicare Part A and B, and most plans have a Medicare Part D coverage as well. They are offered by private insurance companies. They often include additional benefits like routine vision, hearing care, wellness services, and nurse phone line support. How do you get in a Medicare Part C plan? You have to still have that original Medicare Part A and B. You must live in a planned service area, and to further define that, that means the plan must be offered in the county in which you reside. Your eligibility is not affected by health status, and up until the end of 2020, you must not have end-stage renal disease, and that requirement is going away in 2021. Fast facts. Plan premiums and terms can change from year to year. You still need to pay your Medicare Part premium. Remember that B premium, the standard rate for 2020 is $144.60. The benefits are you have the coverage of one single plan. Many plans include your prescription drug coverage Part D. Your coverage could be limited to a service area unless it's an emergency. You may be required to see doctors and hospitals that are included in the plan's network, but you also have the ability to get additional benefits not offered by Medicare, like dental, vision, hearing, and preventative care. So let's talk about the types of Part C plans. And just to be clear, because people get confused, these are not Medicare supplements. These are coordinated care plans like HMOs, health maintenance organizations, preferred provider organizations or PPO plans, special needs plans, which we call S&Ps, which could help you if you have a chronic condition like COPD, congestive heart failure, or diabetes. Health maintenance organizations with a point of service, that gives you some out-of-network coverage, and other plans called private fee-for-service plans, medical savings accounts plans. This is a really important part. When can you enroll? So there's 3 enrollment periods. The annual enrollment period, which we're gearing up for right now, because that starts October 15th and it ends on December 7th. This is the time where every Medicare beneficiary has the ability to make changes to their plan. Now, their changes don't go in effect until January 1, but if you don't make a change between October 15th and December 7th, whatever secondary coverage prescription drug plan that you are in, you will be in again on January 1 of 2021. The initial enrollment period, we call that the IEP. So when you're first turning 65 or you first become eligible for Medicare, you have a 7th-month period that starts 3 months before your birthday, the month of your birthday, and then 3 months after your birthday. You also have what's called a guarantee issue right in this time, where no private insurance company can ask you any of those health questions, and we don't have to list your medications on the application because this is your initial enrollment period. And then the third one, which we see quite a bit since people are working past 65 or people are moving, is called a special enrollment period. This allows you to enroll or switch plans due to special circumstances. Okay, I referred to the Social Security website at the beginning because, again, Medicare starts at the Social Security office. So whether you need to apply for Medicare Part A and B because you're turning 65, or now you're leaving work and retiring and you only had Medicare A, and now you need to get Medicare Part B, this is the website where you can do that application. And when it opens again, you can go back to the Social Security office. So every year you need to review your enrollment periods, research your options, ask questions, get answers, find financial help if you're eligible because there are extra help programs. Make sure you enroll at the appropriate time and meet with a licensed insurance agent that specializes in Medicare products every year to review your Medicare Part D or your Medicare Advantage plan. You can get more information by calling us at Madigan Insurance Group at 847-457-1802. You can email me at Vicki, that's Vicki with an I, at madiganins.com. You're also welcome to gain information from our website, which is www.madiganins.com. All right, it's time for questions.
Thank you, Vicki. It's Carol Razzle from Elderwerks. Welcome, everyone, and thank you so much for a great presentation. We do have the first question. Do you see a difference in the providers that accept original Medicare versus Medicare Advantage plan? And why don't some providers that take original Medicare also take Advantage plans or MMAI plans?
Okay, MMAI plans deal with a supportive living or a Medicaid status. So it would be safe to say that not all Medicare providers, take Medicaid. So MMAI has to do with a supportive living or an institutional living situation where a person is probably on both Medicare and Medicaid. And then the other,
let me ask it again for you.
Okay.
Let's see, do we see a difference between providers that accept original Medicare versus Medicare Advantage? And why don't some of the providers who take the full Medicare plan, the original Medicare, also take Medicare Advantage?
All right, so I think let me just need to clear up a little bit of confusion. So a provider that would be in network for Medicare Advantage. Medicare Advantage has networks. And in order for a provider to accept a Medicare Advantage plan, they first have to have a contract with Medicare, which means they do take original Medicare. A client who is enrolled in a Medicare Advantage plan has all the benefits of original Medicare Part A and B. Original Medicare by itself has no network. Original Medicare is accepted at any medical provider within the United States that accepts Medicare and is accepting new Medicare patients. Medicare Advantage programs have networks and they are managed care. So for example, I'm thinking of many of the physicians that my clients see accept both original Medicare with a supplement, and accept Medicare Advantage plans. I hope that answered the question.
Right. We do have I have some questions ahead of this, but I'm going to ask this one because it's pertinent to what you just talked about. So how do you decide between Medicare or Medicare Advantage plan?
That is a little bit of a lengthy process and best done on a one-on-one appointment with myself or one of my agents, either telephonically via a Zoom meeting or in person. And we actually look at the person's, who are their doctors, what hospitals do they want to use, what medications are they taking, and what about their budget? Do they travel? There's many questions. We offer free Medicare consultations. We never charge for our services. So for that person to get the right answer for them, they would need to meet with one of us to help them decide that.
Definitely. So I think, is it fair to say that if you're looking at Medicare versus a Medicare Advantage plan, a lot of it does depend on what your doctors are and where you're going. Are they in the network if you're interested in an Advantage plan and so forth? So they really have to get all the details through you, and then
Right.
you can really counsel them on that.
We really counsel them. We do a full needs analysis for every one of our clients. We're with them we tell them you have to like us because you're going to spend about an hour and a half with us.
Right. Well, they will like you. You do a great job.
Okay.
So must every doctor or provider accept Medicare Part A and B and supplement, or can they say we don't accept Medicare?
That's a two-part question. So a healthcare provider can say, no, I am not taking Medicare. That means that they did not sign up and they do not contract with Medicare, which means they cannot bill Medicare.
Right.
Okay. The next part was about the supplement, if I'm correct.
Yes, the next part is must every provider accept A and B and the supplement, or can they say we don't accept Medicare? So you've answered the Medicare piece.
Yeah,
What
so they
about
can say yes, we are not a Medicare provider. However, if they say I am a Medicare provider, and we're just going to assume the person asking this question has been a patient of that particular healthcare provider for a number of years. So let's say we have Susie, and she's now turning 65, and she's been seeing Dr. Smith, and she's been seeing that doctor for a long time. That doctor is not going to quit treating her just because she went into Medicare, as long as that doctor accepts Medicare.
Right.
Now, on the Medicare supplement piece, all of those plan letters, A to N, those are federally regulated plans. And there is no difference. So I'm going to use myself. If Vicki has Medicare Supplement Plan G, and it does not matter who the insurance company is, the name on the card, that provider must take my card. So if you have insurance company XYZ and you have a Medicare Plan G, and that Medicare provider or that doctor or healthcare provider accepts Medicare, they will accept your Medicare supplement. We do a lot of educating and use some software to calculate the lowest premium, and we show our clients the lowest percentage of increase, because the unfortunate fact is every year your Medicare supplement is going to increase. So do you want that to increase at a low percentage, or do you want that to increase at a high percentage? We have a way to show you what's going to happen with your premium.
Okay, we have several other questions. First one is, I have Medicare and will be eligible for teacher retirement services enrollment in October. Is that better than a G plan?
That is a very long discussion. And it's kind of like comparing giraffes to grapefruit. So
Okay.
I would just suggest that that person call and come in and meet with us. I'm not trying to avoid the question. We just don't have time here
It
for
is
me
very involved, right?
to
Exactly.
answer that.
Thank you. Next question. Is it the same 7-month period to enroll in Medicare supplement and Part D plans?
Yes, when you're turning 65. So if your birthday is September, okay, in June, you go apply for Medicare A and B. That's the 3 months before your birthday. You have the month of your birthday, and you have 3 months after your birthday. And that allows you to enroll in either a Medicare supplement, no questions asked, allows you first time into Medicare Part D standalone plans, or will also allow you into a Medicare Advantage plan.
Okay. How is SNP different from regular plans?
Oh, special needs plans means that the consumer would have to be medically diagnosed with something like, for example, emphysema or COPD. And then there would need to be a specific plan in the geographic region where they reside that they could enroll in. A doctor then needs to verify that diagnosis. And the special needs plans allows them, for example, to pay lower dollars in copays for prescription drugs.
Right. I think you've answered this already. How do you decide between original Medicare and Medicare Advantage? And my answer to that would be call Vicki, because you have to do all of the comparisons.
Come have an appointment and we'll show you, and you decide at the end which way you want to go. We never really tell you which way to go. We'll give you our opinion, but we educate, and then the ultimate decision is your choice.
Right. How do you get Medicare coverage for the shingles vaccine that does not cost $200 for the out-of-pocket vaccine?
Okay, well, I can answer part of that question. The shingles vaccine is covered under Medicare Part D, the drug plan.
Mm-hmm.
It will not be covered if you go to your physician's office to get it. So some people are going to like CVS, Walmart, those types of clinics to obtain the shingles vaccine under Medicare Part D. I've also heard of doctors writing a prescription. Then you go to the pharmacy and pick up the vaccine, go back to your doctor's office and have it administered. Copays for the vaccine are dependent upon your plan.
Okay, next question, and we're kind of winding down time, well, a little bit of time still. So I received a Medicare card yesterday from Social Security. Am I automatically added to the program with A?
Okay, if you got a card in the mail from Social Security, the way to know that, look at the card you got in the mail. It should say hospital, Medicare Part A, and it will have a date like 9/1/2020. And then it should have hospital Part B, and it should have a date again like 9/1/2020. That means on 9/1, in my example, your Medicare Part A and your Medicare Part B are active and effective for 9/1. That does not enroll you in a drug plan or an Advantage plan or a Medicare supplement. You need to see an agent to get those plans.
I'm turning 65 next year, but my wife is 4 years younger. I will not be working. Do I need to get a private insurance plan out for her for the 4 years until she's 65? Do Medicare-related insurance agents generally have access to those plans and can recommend spousal insurance? So
okay, I'm going to try and break this down quickly because I know we're running out of time.
Right.
So if the person who is working that is turning 65 next year, they could continue to work if they wanted to, and the spouse could stay on the employer group health plan if there is one. If the person is not staying employed, upon termination of that employment and termination of that group health coverage, the wife who is under 65 becomes eligible for COBRA. And then when the COBRA expires, or if they don't want to take the COBRA, the wife is eligible for individual health plans under the Affordable Care Act. Not all Medicare agents offer them. Our agency is a full service health agency. So we do insurance for Medicare health plans, individual health plans for people under 65, and we insure small business groups under 50.
We still have a bit of time. If all supplemental plans are regulated and cover the same things, why do some companies charge more, and why shouldn't one go with the least expensive or cheapest plan?
That's a very good question, and that's a very accurate question. That is true. This is one place in your life as a consumer that you're looking at the price of the premium, and you're looking at the cost of the premium as you age, meaning that percentage point it increases. So again, without using company names, if we have insurance company X and insurance company Z, and there's a $30 difference from Medicare Supplement Plan G, your doctor will take X and Z. Your benefits will be paid the same way. You need to look, especially if you're 65, you need to look at the lowest cost price for a Medicare supplement, and you need to look at the rate of increase as you age. And we can do that. We have software that helps us do that. Give us a call, we can help you out.
Can you explain the special circumstances period?
Special election period?
It says special circumstances. I think it's probably special election.
Okay, so special election gives you an opportunity to change a Medicare drug plan that's a standalone plan or a Medicare Advantage plan outside of the yearly annual enrollment period or your initial enrollment period when you're turning 65. Two very common special election periods. The first one is moving. You live in the state of Illinois and now you move to Wisconsin. You need to change your plan 63 days. And I will tell you, do not change it before you move. Move, make sure you've got coverage, get set up in your new state. Then call us or we'll help you change all of that because like I said, we have licenses in many states. And then you change your insurance. You have a 63-day period after you move to legally have that special election period and make one change within that 63-day period. So moving is very common. Another reason is we have people that are continuing to work past age 65, or they have a spouse or dependent children that are still very much depending on their employer group health plan coverage, and they don't want to leave employer group health coverage and leave their family uninsured. So maybe they turn 65, take Medicare Part A only, and now it's 5 years later, and we're just going to say they're 70, and now they're going to get Medicare Part B, and they're going to leave that employer plan. That signals a special election period for them to come into Medicare to buy a supplement, a drug plan, or enroll in a Medicare Advantage plan.
And we have one last question. Are you locked in forever to the Medicare supplement plan that you choose?
That answer is no. So for example, many times the premiums increase in the spring. The rule is, which most people don't know this, Carol, is you can change a Medicare supplement every month of the year if you want to, just the Medicare supplement. However, when you're outside that election period, that initial election period, and that guarantee issue right for the open enrollment of turning 65 goes away, or in the special election period when you get Part B after working and coming into Medicare, then you have to pass through something called underwriting. And that's literally answering 20 health questions. And as long as you can answer no to those health questions, you could move from Medicare Supplement Company X to Medicare Supplement Company Y, but you have to pass through underwriting.
Well, Vicki, there's so much information here. We've put your contact information and your website and your email into the chat box, so please look at that. Please understand again and remember that this will be on YouTube. We are also doing live on Facebook, starting on our YouTube channel tomorrow. Vicki Madigan, Madigan Insurance, a very trusted partner with Elderwerks, and we thank you so much for your time. Great job, Vicki, and a wealth of information, as we always know. So thank you. Have a great rest of your day.
You as well. Thank you again.
Uh-huh.